cognitive communication and swallowing disorders in both adults and children. And one of the really unique things about this profession is that there's such a wide variety in what you can do with the degree, in terms of job settings, in terms of populations that you're working with, in terms of specialty areas, and I'm going to talk to you guys about many of those different things today. First, we're just going to watch a video clip that comes from the American Speech Language and Hearing Association that is just a little bit of background about the profession.
Being a speech language pathologist is a great career.
I train doctoral students in audiology from different universities, and it's always rewarding to not only to train them but to learn from them.
Being an audiologist is fun, rewarding,
and I love that speech language pathology was a very diverse field and a financially stable field.
And speech language pathology is very important because everyone has a right or a need to communicate.
I'm inspired to know that I'm making a difference. I'm inspired to see the growth that my students are making.
Whether your interest is working with kids or adults in a school or a hospital setting or a private practice, there's really something for everyone.
Getting to see the children grow and being able to see how their language is developing from infancy when they first come in to when they leave in the 3rd grade. They're just chatting away, and most of these parents maybe didn't even think that that was possible. So when you get to have a conversation with a child who was born deaf, that's just amazing and so rewarding to know that I'm part of that process. My name is Julie Martinez-Verhoff, and I am the Director of Audiology at the River School in Washington, D.C. As a mentor, I train doctoral students in audiology. Currently, we have a doctoral student named Jennifer who is really great. She was diagnosed with a hearing loss when she was 5 years old. The students love when they come into the clinic and they see Jennifer and they see her hearing aid, and they'll be like, "You wear a hearing aid, so do I." You ready? It's going to be on your left side. It's so rewarding to see the children here is once they get to the final grade, to that 3rd grade, and they leave and they're mainstreamed. That's amazing that they can go to the library and get a book by themselves, that they can pick up the telephone and talk to their friends, and these children can do that. They can sing, they can play the violin. These are all exciting things, and audiologists are a part of that.
My job is really rewarding. I work in a rehabilitation hospital where patients are seeing improvements after an injury, and it's great to get to build a relationship with them over the weeks where they're starting to see some improvement after what's been a really hard time for them. I'm Mackenzie Fama, and I'm a clinical speech-language pathologist at MedStar National Rehabilitation Hospital. I'm on the stroke team, so I work primarily with patients who've suffered a stroke, but I also have the opportunity to see patients on other teams such as traumatic brain injury, spinal cord injury, or cardiac rehabilitation. Now I'm going to have you looking at this screen over here. A typical day for me is pretty unpredictable. My sessions are either 30 minutes or an hour, so I may work with someone on their speech, someone with a swallowing disorder, someone with cognitive impairments, and then someone with a language disorder. I get to work very closely with occupational therapists, physical therapists, nurses, case managers, and physicians. We are constantly collaborating to make sure that we're giving our patients the best care possible. I've recently taken the opportunity to become involved in a research study that's looking at improving rehabilitation techniques for stroke patients, the same type of patients that I work with every day in my job. Getting involved in this study has inspired me to return for the PhD so that I can become more involved in research in my future career. I would recommend the field of speech-language pathology to anyone who's considering entering it. It pulls from a variety of backgrounds, and it's so diverse that really you can do a lot of different types of things within the field, whether your interest is working with kids or adults in a school or a hospital setting or a private practice. There's really something for everyone. There's a lot of job security, and I think that there's a lot of opportunity for changing within your career throughout your lifetime.
I chose to work with young children because throughout my career I've worked with birth through elderly, but it's the younger population, the infants and toddlers, where I get more joy because it's the developmental stages and I'm making an impact that will last throughout their lives. I'm Charles Coward, a speech-language pathologist and manager of Connections Therapy Center. I'm a speech language pathologist because I love working with children. I love seeing children grow and change. And speech language pathology is very important because everyone has a right or a need to communicate. Donovan is a wonderful little boy with a bubbly personality, and inside of him, there is the ability to communicate more consistently, and I'm just trying to find out which door I have to unlock in order to open so that he can communicate effectively and efficiently every day. In Donovan's session today, since he's a nonverbal child, we're working on getting him to consistently use the sign for please and teaching him the sign for apple. Now let's go for apple. Good. To see where he came from and what he's doing now and what he has the potential to do is just remarkable. In the future, I can see myself working in theater or film, teaching actors ways to improve their articulation, and with more training, I can also be a dialect coach to teach the dialects for character development.
Being an audiologist is fun, rewarding, it's challenging. If you like problem solving, if you like working with people, it's an excellent place to be. My name is Shizuko Tamaki. I'm an audiologist of Professional Hearing Services in Falls Church, Virginia. On a normal day, I may be seeing a 4-week-old baby, doing a hearing screening on them or diagnostic testing on them. I could be seeing a 99-year-old coming in for a hearing test and hearing aids.
That causes me great discomfort.
This patient is coming in for dizziness and balance evaluation. So we're going to be doing hearing tests, and then we're going to be doing what we call video nystagmography or VNG. It's got infrared cameras in, so I always try to explain what's going to happen, what goes on, because that also eases their tension, and also they feel more comfortable with what they're going through. Eyes wide open for me. We're going to be looking at her eye movements as we put her head into different positions. And we're also going to be looking at her eye movements when we artificially stimulate her inner ear balance organs. Can you hear my voice okay? In about 5 years, I probably want to ramp up my career to either a different direction or just at an advanced level. But I don't feel like I'm limited because there are so many other opportunities in audiology. I could be doing more research. I could be teaching full-time. I could be a director of some audiology clinic. There's so many opportunities there.
So going back to, I teach graduate and undergraduate students in speech language pathology, specifically clinical practicum courses. And the courses really are teaching students how to apply the theory that they've learned into the practice when they're working with their actual patients. I'm Martine Ellie, and I'm the clinic director at the Howard University Speech and Hearing Clinic.
The younger grades,
I decided to become an SLP because I always wanted to do something that would make a difference in people's lives. There's not one typical day, it really varies. I can do things such as teach classes in a day, supervise students that are working with clients, do community outreach, give different challenges, different opportunities, different things to do. And so that really makes the job more interesting. For the last 2 years, we've gone to Haiti during spring break, and we've provided a number of different services. We have done hearing screenings, dental screenings, and a number of different healthcare initiatives within the community. ASHA is a vital part of everything that I do in my professional life, from certification to professional development, to policy statements, to advocacy, not only for the profession, but also the clients that we serve. I'm passionate about the field of speech language pathology, and so teaching it just allows me to do something that I really like to do. I'm teaching a skill about something that I am passionate about.
The thing that's most rewarding about being a speech language pathologist is getting to work with the adolescents that I see every day, to be challenged by them, to be inspired by them, and to help them learn to be successful. I'm James Brinton. I'm a speech language pathologist at the Catherine Thomas High School in Rockville, Maryland.
I'll read it. I want you to follow along.
I chose to work with high schoolers with moderate to severe learning disabilities because I realize it's very important for them to have the skills to transition out of high school into adulthood. I work with a social worker for each student. I also work with an occupational therapist, and a school psychologist, we come together to collaborate on the goals that the students have. The American Speech Language Hearing Association supports me in 2 ways. They provide scholarly articles for me to read as I research about my clients, and they also keep me connected to other professionals in my field in different settings, such as a hospital or a clinic.
That's what we get to for open mouth. So
with the experience that I've gained here, I hope to get a strong clinical foundation and either someday open up my own speech practice or return to a university to teach and supervise clinically. I love working with the students. They challenge me and inspire me every day. I love the support staff and the school, and I think being a speech-language pathologist is a great career. At the end of a workday, I definitely feel like I've worked hard. I have a sense of fulfillment knowing that I've improved students' lives, and I look forward to the next day.
I became an SLP because I knew that there was diversity in this field, and I knew that I would have the opportunity to help people communicate. 8 years now in this profession, I wouldn't have it any other way. My name is Trina Celeste Gatson, and I am a speech-language pathologist. One thing that I really enjoy about my day is that it's definitely not routine.
You'll say them and then I'll repeat them after you.
From working with patients with voice disorders to neurological disabilities and speech to swallowing. Sometimes it might include community outings or working with other therapists to make sure that we're treating the entire patient. One of the most exciting experiences that I've had is working as a travel SLP. I've lived in Chicago, I've lived in Dallas. So just having that opportunity as well as building my career is something that this field has afforded me. My patients inspire me. They have a magnificent ability to be resilient. So Tajay is a 19-year-old college student who had a brain tumor. One thing that prompted this type of outing is that Tajay expressed that she likes to eat out a lot, and her friends and family were ordering for her because of her fear of not being understood. So today was a perfect opportunity to take her out, have her order for herself, and build that confidence that she is intelligible and people understand her. Knowing that Tajay is so close to returning to college and the community is such a rewarding feeling that it's hard to put in words. She is an amazing person, and to have met her at this junction of her life is, I think, more beneficial to me than her. Yeah.
So I showed you that clip because I think it highlights a lot of the different things you can do with the speech-language pathology degree. It also talked a lot about audiology, and just to back up a little bit, the undergrad programs for audiology and speech-language pathology are typically one and the same. So my undergrad degree is in audiology and speech sciences. Many of them are in communicative sciences and disorders, but the requirements, the undergraduate requirements for a graduate program in audiology or a graduate program in speech-language pathology are the same. And then you specialize when you go into graduate school. So we're going to touch on these as we go through each of the job settings, but these are just some areas that you can target if you're working as a speech-language pathologist. Language is the use of words to communicate, but not just words. It can come in written form, it can come in picture form, it can come in many different forms. Expression is the use, and receptive is that understanding piece. And the other thing when we deal with expression that falls under there also is the articulation or the speech sound production piece that we target often with little kids. And then pragmatics. Pragmatics are the social engagement skills that go along with language. This is where we focus most of our effort when we're working with students with autism, especially older students with autism. Voice, so volume, tone, quality of your voice. If you have vocal nodules, if there's some paralysis in the vocal folds or different anatomical differences in the larynx, stuttering, swallowing. The anatomy for speech and language and for swallowing are the same. So this is something you probably wouldn't think of when you immediately think of a speech-language pathologist, but we do, in a hospital setting, deal with swallowing. So we do things like stroke patients who have lost some of their, have weakened functioning on one or both sides of their body. We do barium swallow studies, so they swallow barium under an x-ray so you can watch where that food goes and make sure that none of it is aspirating into the lungs. And then make a decision as to what type of diet that person can be on that they can safely swallow. Do we have to thicken their liquids? Do we have to do things like that? And then cognition and executive functioning, so the ability to think and process your language, to plan and execute organizational skills and things like that. So those are just some basic areas that you might deal with if you're working as a speech language pathologist. But it's really important to know that virtually everyone at some point in their life will have interaction with a speech language pathologist. Why? Because this is one of the few professions where you can truly work from birth to death. So we're working in premature babies in the neonatal intensive care unit. We're working with end-of-life care in terms of declining health and working on the feeding and communication skills that may be declining at that point. So we're gonna do a little activity, and this is just to highlight something that somebody with a language disorder may experience. So I'd like each of you to get a partner. It looks like you're pretty well paired off. The three of you are good. And I'm gonna set my timer for 2 minutes. And I want you to have a conversation with the person sitting next to you. If you've done it before, just bear with me. About your plans for the weekend. But the catch is you may use no more than 3 words in each sentence. Okay? Go.
Early drive.
You could say like a 3-word thing, you could say 3 words and you like a whole freaking sentence of like kind of, you know, tell me 3 words to meet the sentence.
Why are you laughing? Tonight, 1 a.m. Tell 1 a.m. I'll be there. What?
What does that mean? It's a funny sentence, but it's I know I could.
Oh, yeah.
What do you say? Okay. Have you watched Captain Kirk?
That was way more than 3 words.
Long time since
Alright, there you go. That was your 2 minutes. Was that easy or hard? Why?
What's your sentence?
Why was it hard? Put your attention back to me, please, so we can have a discussion about this. I took a task that's automatic to you, something that you do without even thinking, and I turned it into a cognitive task. I turned it into something that you had to think and process while you were communicating. Did your sentences always make sense? Yeah. No, you said yes. Were you using the same sentence structures and grammatical markers that you typically use when you're having a conversation with your friends? No. Did your conversation, the back and forth, flow the way that it would if you were having a conversation with your friend on a normal day? No. Were you making comments and answering questions and asking questions like you normally would if you were engaging in a conversation? No. Most of you were just making statements. And the statements you were making were not even always relevant to what your conversation partner had just said to you. Why? Again, because I took something that's automatic, I turned it into a cognitive task. While your conversation partner was talking, what were you doing? You were thinking about what 3-word sentence you were going to say next. What 3-word statement you were going to make next. Okay. So, this task, this activity shows us a few things. One, it helps you kind of experience what it's like to have difficulty with communication, to have to really think that's the lunch bell that you guys aren't eating yet, right? Okay. Well, we're not even close to done. You had to think about it, okay? I put you in the shoes of somebody that has a language disorder. I put you in the shoes of somebody with autism who has struggled with those back and forth flow of conversation, is focusing so much on what they're saying that the things they're saying to you don't always make sense. And I also put you in the shoes of somebody who may be a stroke patient or a traumatic brain injury patient who has always had normal cognitive and executive language functioning, and then what happens? Some sort of medical event or brain trauma, which leads them to have difficulty communicating. So that's what they're constantly doing, is struggling to get their words out, okay? And those are the kinds of things that you would be treating if you were a speech-language pathologist. Educational requirements, and there are some changes here. This is the current process. However, I'm not sure if it's 2020 or 2022, but I'm guessing that I should have fixed it because that's where all of you would be either way. That master's degree is actually changing to a doctorate degree, similar to the process for becoming a physical therapist. And the audiologist one has already changed. It's already an AUD. So you get a bachelor's degree, and there are a number of undergraduate requirements that you have to have when you're applying to graduate school. So even if you don't major in something like communicative sciences, some people do like a post-bac year where they're getting some of those requirements in once they decide that's what they're going to do. A master's degree or doctorate level, a postgraduate degree in speech-language pathology, and this is again where you would specialize, where you would branch out in the speech-language pathology or audiology fields. And looking at, it's not easy to get into these graduate programs, so it is really a rigorous undergraduate that you have to maintain your GPA. You have to get a high score on your GRE. You have to be building connections with professors and other people in your community to get letters of recommendation. And those things are all really important. And then once you've graduated and you've earned that degree, and as a part of the master's degree, you're doing a lot of clinical placements in education where it's work-based education. And then you're going to do a clinical fellowship year where you are working, but you are supervised by a certified speech-language pathologist who, at the end of that year, will sign off and say, yes, you've met the requirements to have your certificate of clinical competence through the American Speech-Language Hearing Association. You also have to pass the National Praxis Exam, and in many states, including Michigan, there is a licensure process also. In some states, if you do want to work in the public schools, they do require you to have a teaching certificate. That is not a requirement currently in the state of Michigan. So, job settings. We're gonna buzz through some different job settings that are possible, because this is one of the coolest things about speech-language pathology, is that you can use the degree in such a vast array of circumstances. So, my current position is a school-based position. I support the development of communication skills within a school setting. I have experience working with preschoolers all the way through, my current caseload is mostly middle school and high school, upper elementary through high school. But I worked for a number of years with the preschool population, working on teaching communication skills that are necessary in order to engage in the general education curriculum. Can you say all the sounds that are developmentally appropriate in your words? Are you understood by others when you communicate? That would be an articulation disorder, where I would be focusing on specific sounds or sound patterns to help a student be able to communicate in an effective way where others can understand them. Kids that have limited vocabulary, which will be similar to that activity we just did, they don't always have the words, so we're teaching and facilitating vocabulary development, sentence structure, more, as they get older, we're working on more abstract language concepts like figurative language or synonyms and antonyms and all of those things that kids, many of you will learn just based upon engaging with your environment and your education and your teachers or your parents in your environment. But there are students who don't develop those skills naturally, and they need to be explicitly taught these skills in order to engage at school. Pragmatic language. This is a huge part of my job currently, is working with the population of students who have autism. So teaching them socially appropriate language and how to engage in conversations and things like that. Facilitating the LINKS program, which is basically teaching peers how to interact with students with autism. Stuttering, and then also with that language-based background, we have a unique understanding of language development, which relates and connects directly into literacy development. So we work very closely the most important thing to remember, and this doesn't go just for school settings, this goes really across all the settings, is how closely we work as multidisciplinary teams, both through evaluation and treatment. So I am in constant communication with the general education teachers, with the special education teachers, with the occupational therapists, with the physical therapists if they're involved, with our school psychologist and our school social worker. We all work together as a team, with the parents and the families also being a part of those teams in order to really treat the whole child at once and facilitate that development in a more appropriate manner. Hospitals. So this is again, this is a place where we can look at pediatrics and geriatric populations. Most of the time you would specialize in one or the other, but I do have friends that work in hospitals that kind of bounce between. But acute care would be those patients that have just had recent strokes or from brain injuries, and we're working on the initial care of that cognitive communication and making sure, assessing whether or not they've lost any functioning in the area of communication, what areas we can provide treatment in, and then also looking at the swallowing falls in the acute care piece also. Rehabilitation, sometimes there are inpatient rehabilitations where you're doing more of that treatment and getting them ready to go home. But language, voice, cognition, articulation, and swallowing are all involved in both the stroke care and traumatic brain injuries care. Cleft palate, infants or children that are born with different syndromes or medical diagnoses that may lead to difficulties with communication, vocal nodules or different kinds of disorders that come with the actual structures of your larynx, laryngectomy patients, tracheotomy patients, high definition imaging. This is kind of a newer piece in the field where you're really a part of the team that's doing brain mapping and MRIs and CAT scans and all these really cool things. And you are focusing on the areas of the brain that are involved in communication and seeing if they're functioning appropriately and working with the neurologists and the medical teams there. Surgical support. This is, again, a newer kind of up and coming part of the field. It's a pretty specific kind of job. There are kind of few and far between, but I don't know if you know that oftentimes when you have brain surgery, you're awake. What? Really? Yes, because one of the goals of doing brain surgery is that we don't disrupt any additional functioning of your brain aside from removing the tumor or making the repairs that we need to make. So, as a speech pathologist, what would that mean for me? I would be in there while they're working in the language cortexes of the brain, asking questions and watching what they're doing and making sure that we're not leading to impaired communication as a result of that brain surgery. And then the neonatal intensive care unit. These are our tiniest of tiny little babies who are born prematurely, who maybe haven't developed the anatomy or the muscle strength yet to do things like suck and swallow. So we're working on giving the appropriate.
So I was laughing, but oh my god. Now we're all gonna stare at you though. I'm laughing.
Giving the appropriate, there are specialized bottles and equipment and ways that we can manipulate those structures in order to. Sorry, I had comments.
Oh, I do it all the time. They're used to it. You see how most of them are just like, yeah.
Okay, so leading to the next outpatient setting, outpatient clinics, where we're again working with different kinds of patients on those same levels of skills. And most of these clinics are like specified, like you would go to a brain injury recovery center, a pediatric therapy center, stroke rehabilitation centers, things like that. Wait, why am I going so fast? Let's do this one. Get their attention back.
Hello, welcome to Take a Minute, the show that puts your brain to the ultimate test. Let's see how many questions you can answer. Are you ready? Your minute starts now. Who painted the Mona Lisa? Was it Da Vinci, De Niro, or DiCaprio? Which planet is closest to the Sun? Venus, Mercury, or Mars? In which year did the Battle of Hastings take place? 1066, 1666, or 1966? Who invented the light bulb? Was it Bell, Ford, or Edison? In which year did the Titanic sink? 1912, 1955, or 1991? What is the capital city of China? Shanghai, Tokyo, or Beijing? Who were the first man on the moon? Neil Armstrong, Bob Aldrin, or Michael Collins? How many invented Did you get all that?
No.
Yeah, I actually did.
You're good.
I could block all of them out and hear just him.
You are superhuman.
Thank you.
Oh. So, this is another example of, I gave you the expressive language example earlier when we had the conversations with no more than 3 words. This is a receptive language, an auditory processing task, okay? And this is another area that can be impacted either in a variety of populations, from young children through adults who have suffered different types of brain injuries. And it's really important to think about when we think about our population with autism, because they often require, one of the simplest things we can do for them is provide additional processing time, okay? Allow them time to listen to what they've said, because this is exactly what happens in their brain if we're repeating the direction we're going on to the next question too quickly, is that we're resetting that 15 seconds every time, and then it's all overlapping and they're not processing that information appropriately. Also, for you find that frustration where you weren't understanding the questions at the end, this is something that your stroke patients or brain injured patients might experience also. Okay, couple more job settings. Skilled nursing or rehabilitation centers, so our nursing homes, or rehab centers, where the goal in a rehab center would be that we have a patient in a residential facility who our goal is to get them home. So family-centered care, we're working with the families on how is this patient going to eat safely when they go home? How is this patient going to communicate with you when they go home? And all of those things. And then for stroke patients, same thing. We're working on the treatment of development and the end-of-life care. So you see a rapid decline sometimes in end-of-life in our elderly population, where we see a decline in the oral motor functioning for swallowing or in the communication, and we're giving them different tools to maintain that quality of life as they age. And this is, again, a big part of this is family-centered care, where you're working with the families also. And then, okay, so a couple of other really interesting job settings that could come out of working with speech pathology. Working with augmentative and alternative communication. What does that mean? It means we're using technology to communicate. It means somebody doesn't have the ability to communicate verbally for some reason, so we're giving them an iPad with a device where they're spelling out or using pictures to create sentences. You do have a student up here in your school who this is how she communicates. This is something that we work on with young children as we're starting to develop and facilitate their communication, and a lot of the research shows that if we can give them a system to communicate, that verbal will often follow. Or there are individuals who have some sort of degenerative disorder or something that happens that takes away their ability to communicate. We give them an alternative mode using some sort of technology. Voice change. This again is something that's coming along with society in general. So we've got our transgender patients who want their voice to sound more masculine or more feminine. They come to a speech language pathologist to help train them on how to make those changes safely without injuring their vocal cords. We've got what we've called the Kim Kardashian effect, where it has nothing to do with transgender, okay? It has to do with people just wanting to sound different for whatever reason to fit into a different social group. We have like dialect coaches that are working with, like in Hollywood, with actors or actresses that need to sound differently for different roles that they're in. So there are a lot of specialized fields that really do come from having this degree in speech language pathology. Telepractice, this is like, this gives me anxiety, because for me, so much of what I do is about that face-to-face interaction and relationship building. However, with the way of the world and how important technology is in our society right now, there is a lot of telepractice across the medical profession where therapy is happening over computers and iPads from remote settings and different things. So it is something that's possible. I have worked with a group out of Michigan State who's doing telepractice with a clinic in Mexico. So I know that it can be effective. Just to me, it misses some of that interpersonal communication piece that I feel is so important. And then of course there's always the university teaching and research route when you are So, I'm going to end with a video clip that, or activity, just to get you thinking, because this is something, there's a message that comes from this that I think is so important for you, no matter what you do once you leave the walls of this high school. So,
my name is Susan Boyle. I'm nearly 48, currently unemployed but still looking. And I'm going to sing for you on Britain's Got Talent today.
That's nervous.
Yeah, sure, no.
Yeah, well, that's not surprising. What are you going to try?
I've got a fighting mood, you know. At the moment I live alone with my cat called Pebbles. But I've never been married. Never been kissed. Oh, shame. But it's not an advert.
And have you done this for many a year?
Since I was 12.
Since you're 12?
I've always wanted to perform in front of a large audience. I'm going to make that audience rock.
Hi, what's your name, darling?
My name is Susan Boyle.
Okay, Susan, where are you from?
I am from Blackburn near Bathgate, West Lothian.
It's a big town.
It's a sort of collection of villages. That's a thing there.
And how old are you, Susan?
I am 47. And that's just one side of me.
Okay, what's the dream?
I'm trying to be a professional singer.
And why hasn't it worked out so far, Susan?
I've not been given the chance before, but here's hoping it will change.
Okay, and who would you like to be as successful as?
Elaine Page.
Elaine
something like
Page.
that.
What are you going to sing tonight?
I'm going to sing I Dreamed a Dream from the Miserables.
what are the judges in the audience expecting?
Like, she about to be like, ah!
Any other observations? Are they expecting her to be good?
No.
Why?
Because first her accent, and second, she's like, I'm like 40 like now.
So her behavior, her mannerisms, the tone of her voice, all of those things will have to play in.
Okay. Think so?
Yeah? Yeah.
I dreamed a dream in time gone by.
You didn't expect that, did you? Did you? No.
When dreams are made and used and
really, really, really good, right? I show you this because it is such a powerful message to know that everyone has some sort of hidden talent. To always believe that there is potential in every person that you meet. Don't judge a book by its cover, because if you go out into the world and you become a medical professional in any, or an educator or a business person, it doesn't matter what you do. You are going to meet people who are different from you, okay? And I challenge you to, when you have those things happen, to go into it with an open mind that they will probably surprise you, that they have more to offer than you initially may think when you meet them. So, on that note, does anybody have any questions?
On Little Big Shots, I think it was Little Big Shots, well, there's this girl that has autism, and she's a beautiful singer, and they had her singing with pentatonics. It was beautiful. Like, I cried. It was so good. She was so
And if nobody gave her a chance, right? Susan Boyle is an individual with autism. She was diagnosed later in life. She did go on to win this competition, and was moderately successful in her life beyond that because of her autism. She very much struggled with the social expectations that came along with becoming famous. Right? There you go.
Questions? I know you guys got some. Really? None? That surprises me.
Yep. I work, especially in a school setting, I work very closely with our school psychologists. Do you want to know our professionals are involved?
All right, so I know a lot of times I like explain to you guys like make sure you're reaching out, meeting people, don't burn bridges, come professional, because there's a reason that you always want to be perceived as professional, because you don't know who you're gonna meet in the future. You don't know if that next person that after you leave the class here, maybe you might be interviewed by them in the next, I don't know, some of you guys as seniors in the next 4 years. So that's why I was trying to say, like, come professional, put out your best, give your, and just show up, like, be your best you that you can be. So the reason I'm going around with that is because our professional circle has, like, done this weaving and winding thing. So my very first experience with the speech language pathologist, which I knew what the profession was because I went to Central Michigan University, and of course they have a really good program there. But I didn't really know exactly the depth of what they did. So Azalea, my daughter, the one you guys have all seen in here before, she was born at 34 weeks, but she was also SGA, which is small for gestational age. And so my very first experience with the SLP was the fact that we had to teach my kid how to suck and swallow.
Okay, that's not why I left. Okay, Sam.
She did not have, because she didn't gestationally, she wasn't at the age of which that reflex comes into place, a little bit later when you're a little older in the mama's belly. She didn't know how to swallow. So something would go in her mouth and she kind of chew it a little bit, but she didn't, put her mouth around the bottle nipple or around, when I was breastfeeding. She couldn't do that. She just didn't have that function and it didn't connect. And so the speech language pathologist, now I know who they are, like basically taught me tricks on how to get her to do these little things. Make sure that when you're doing it, you're opening your mouth up wide. Make sure you're doing this. If you have to put your finger in the side of her mouth, just kind of get her to realize that you're supposed to do these two things simultaneously together. Because if you have a baby that can suck, but they can't swallow, then they're still not getting the food. And so one comes before another. Okay. So that was back then. That's how I learned about the profession for real. Then let's fast forward. Actually, no, we have to go back in time 5 years. And so from when Azalea was born. The worst injury, or one of the worst injuries I've ever had as an athletic trainer, happened on the soccer field. As some of you guys know, soccer is my sport. That's like this is sport, that's what I played in high school, college. So this young lady, who happened to be one of my little beasts, she goes barreling down the field, and I literally just turn around for a second, and I hear the most horrific sound that I could possibly hear. It sounded like cars crashing, but it wasn't cars, it was people. And then I heard this terrifying scream, like a howl, a primal howl. And I look on the field, And this athlete was not really, you could see she was still screaming, but she was not moving. Like, she refused to move. So I run out in the field, get the other athlete off and away, because we'll talk about that in a second. And I look at her leg, I'm like, holy crap, what have I got myself into? Because it was probably one of the more interesting fractures I've had. So she had a complete lower leg fracture, so both bones in her lower leg were fractured as well as they were displaced. So it looked like her entire leg did kind of like this. Her lower leg did this, almost made like a zigzag. And then a little bit, there was the tibia a little bit poked through the skin a little bit also. So I'm sitting here and, you know, I get her settled down, I splint her up, and I'm waiting for EMS to arrive.
For 45 minutes.
Forever. And I even told them what was going on. And so finally EMS comes, and then they want to argue with me over how to treat this student. And I was like, no, they wanted to remove the splint. And I was like, you're not removing this splint, because you're just gonna make her go right back in pain all over again. We just got her stable, right? And so we fought, and when I mean fought, like I was like football lineman angry, because you're not touching my kid at this point. You're not touching my student, my athlete. So we fought back and forth, and eventually the police were like, just go and take her to the ER. Because ultimately EMS wasn't gonna do anything different than what I had already done. And so they took her to the ER, and it was a very long, full 18-month healing period for her. So, fast forward.
That's my younger sister, by the way.
Her younger sister.
Not me.
So, I know. So now we're gonna fast forward to when Azalea was about 2. And she went to city school. Or, no, she was in preschool at the time. Maybe it was before she was even in preschool. And I noticed that she started to stutter. And the problem was that she knew she was stuttering also. She didn't know what stuttering was, but she knew that she was trying to communicate and it wasn't coming out. And that made her more frustrated, which made her stutter more, which made her more frustrated, which made her stutter more. So I'm like, I don't know this area. This is not my area of expertise. And I'm really easily, if I don't know something, I go research it. And one of the teachers there was like, you should speak to our speech language pathologist. And I'm like, well, I will do that. So I sent out this email and I introduced myself. And we're kind of talking back and forth via email for a while, actually, before we realized that I met her several times at this point, because I knew her sister and everything like that. So we got through the whole Azalea thing. And then she was at the school Azalea goes to, so Azalea, as she got to see Azalea actually grow up, and then she came to the high school at the same time that I started coming here to teaching. So then let's fast forward 7 years? 7 or 8 years, yeah. Oh my God.
So my son is going to be 2 in the end of June, and he was born early and has had some physical delays throughout his development, and also some neurological red flags that we were at a period where we thought he was having seizures. So what do is I turn back around and reach out to my people that know about physical development, who helped me get in with the best physical therapists and occupational therapists we could, so that he could get early intervention and treatment. Now no longer doing really well.
And so now they're both just little stubborn creatures, is basically what we boil down to. Hard starts lead to stubborn children. So, which is not a bad thing, but make sure you keep your circle. So when you make those connections within the profession, keep them. Reach out, use them if you need to, because I've never heard a professional not appreciate that, because you never know when it comes back around. I'm like, actually, I already did. I already contacted her again, like, my nephew's doing this, this, and this. And she's like, here, try this person, this person, this person. I'm like, got you. And use it, because it's going to be back and forth, and that's what personal and professional relationships are about. So.
And also making those connections and getting to know the people in your field, because I know that the vast majority of my career has been spent working within the public education realm in some capacity. But I know I have made connections outside of the schools, and so when people call me, I have typically good reference points to refer to in the community, and also to, I know who to call to find out the information I need if there's not somebody that I know personally. So, yeah.
All right. All right, next week, what's up? And? All right, have fun at your potato bowl Friday. That's today, right? Yeah. What? I didn't think it over. Not this day. Whose blanket? Please put it away. I don't know whose it was. I don't know whose it is. Fold it up and just go ahead and put it away.
Yes, okay.